Medical Legal Consideration and Endodontics by Morgan et al. In 2025, which was published by the British Dental Journal. The United Kingdom and Ireland are now considered antecedentally to be the most dental-legal countries in the world, with subtle differences between the constant regions and countries, relating to cultural, social, legal, and judicial differences. Society is also increasingly consumerist, with a greater access to information by the internet, and some legal firms market as a no-win, no-fee approach. Additionally, endodontics is a clinical discipline where the litigation is a common standard of care. With the initial guidance on the expected standard of care, which was adopted in the late 1950s with the Bolam tests, where essentially the treatment provided should correspond with that expected from a reasonable clinician, which was strengthened afterwards in the late 1990s by the Plothio tests, where the treatment decisions has to be supported by a reasonable body of an opinion. The expected standard of care will therefore depend upon who provided the treatment as well as when it was carried out, and will be slightly different from those practicing as a specialist rather than a general dental practitioners. So to help the profession codify the expectations for the general practitioners, the faculty published the Standard of Dentistry in 2006, which was updated in 2016. This document recognized that expected standard documents could be misinterpreted by regulators or legal entities as required standards, and so categorized them for the clinical error, which including endodontics as a basic or credential for endodontic specialists in the UK. Expectations would be comply with the standards embedded in a good endodontic practice. For the inherited cases, a comprehensive dental history is required, which include where the patient received orthodontic treatment or suffered with an endodontic treatment which was provided originally. In the past, some treatments taught in the dental school, like the single silver cones, were considered usable but are now unacceptable. When a patient received endodontic care that was acceptable at that time, in the absence of a clinical or radiographical evidence of a periradicular pathosis, and alongside document discussion with the patient, it would be reasonable for the current dentist to monitor the tooth using contemporary methods. Any retreatment would, however, be expected to conform to the current, not previously accepted standard. For the complexity assessment and consent in endodontics, an essential part of the endodontic treatment planning process is a definitive diagnosis and throughout the analysis of all factors that contribute to the complexity of the intended treatment. Once completed, this complexity assessment will be the core of the consent discussion with the patient as to inform the inter alia who is the best place to undertake the treatment. So the likelihood of a technical and biological success, the potential longevity of the tooth post-operatively, and how this might compare with alternative treatment suggestions. And it's then possible to complete the plan for the treatment and have a meaningful discussion with the patient about their opinion to gain a valid consent. As in the complications part, while not required to all the territories, the principles of the duty to candor, which exist in the UK in both stationary and the professional form sets, with a good ethical start point for managing complications after a procedural errors, has been taken place with the General Council guidance notes. This means that the healthcare professionals must tell the patient when something has gone wrong, apologize to the patient. For the personal consequences, in the UK, dentists can expect statistically to be threatened with ligation twice in their practicing lifetime. Although the likelihood is small, the threat is often highly significant as professional and personal identities are closely intertwined. One study has noted that the highly stressful nature of the general practitioner investigation leading to dentists leaving the profession, and over 1/4 of considering suicide. It is important, therefore, that when it's complicated is received, the clinician seeks support by talking to their work colleagues, friends, family, to avoid becoming isolated and seeking professional help in the form of their intimidity, organization, and receive an appropriate counseling or medical intervention as well. So, as a conclusion, it cannot be emphasized enough that the practice of a clinical record of the assessment as the diagnosis, treatment plan, and the consent process, along with the provision of the treatment and also the current standard of care and the discussion of the complication as they arise, in addition to ensuring that the adverse outcome are defensible.